I've worked here for 23 years, and beyond being a director of a department with 60 staff members, I want to share a personal story I have with the importance of restoring funding for Day Kimball. Had it not been for Day Kimball in February of 2015, my daughter needed an emergency C-section, and she needed it quickly, and Day Kimball was here for her. Our first grandson was born. Everything was positive outcome, and honestly, to think that we would have to drive another 38 miles to the nearest hospital would be alarming. So the Day Kimball has done what they've needed to do to cut back on staff and maintain the mitigation of funding. But now it's time for the state. And luckily we do have representatives and Senator Flexer leading us to have these funds restored.
This means a lot to the local community. We are the only hospital within a distance from Hartford. So if I get sick and I have to go to Hartford, I would not appreciate it.
It's critical that Day Kimball Hospital had this $3.8 million restored in order to keep the hospital running. Day Kimball is critical to our corner of the state. It's the only provider of this kind of healthcare services, and it's really important that they received this funding that they were counting on and that we fought so hard and was promised to them. So we're really glad to be able to be here today and support of the staff that were such tremendous advocates for the funding for the hospital, and we're glad we were able to work together to restore this funding, and we know that Day Kimball is going to have a brighter future because of it.
They're a vital resource to the community, to the local economy, access to health care, and even property values. The quality of life that they provide to Northeast Connecticut is really crucial, and I'm appreciative of everyone that fought hard for Day Kimball Hospital, as well as my colleagues.
It's been a long, tough battle, but I think we came back with the results we wanted, and it's so critical for this area as far as health goes. You know, without Day Kimball, people don't really realize how far we have to travel to get health care. So it's a great deal for the job, but it's also great for the health care of the area, which is so desperately needed.